Hi everyone, can we all see me? I don't know if we can all see me. I'm just trying to. It's long I did a live. Oh my god, I don't know this mess. So it's so long I did a live, so I'm just trying to be sure that everything is set. That's why I'm kind of here early. Somebody is here. Welcome. Anyway, you're joining us from. Good afternoon. How are we doing? I'm still waiting for my guest to join us. Welcome everybody. This might not be the best of my life today, but we'll do something. I think she's. Hi, good afternoon. Good morning, ma. How you doing?
I'm good, thank you. Good morning. How are you?
I'm fine, thank you. Let me increase the volume. Okay, good afternoon, everybody. Oh no, this morning. Yeah, you can be afternoon. Good morning, good afternoon, good whatever time you are. We are back on another live show. This is Nos Ofela, and we're going to be discussing midwifery, how you can transition. Because I've gotten that question a lot on the channel, and I've been trying to get the consultant to come talk to us. She's been so busy, and I'm so grateful that she's here today. So today, I'm so glad that she's here today because we've been planning this back and forth, and finally she's here. So we're going to be answering all the midwifery questions today, how you can transition, the business side of it, because she also owns her own practice. So I really love that, the fact that she's in the best position to answer most of our questions today. So welcome, Ma, and thank you so much for joining us today. I'm so glad to have you here. You can please introduce yourself to our viewers.
Thank you, my dear. And hello, viewers. My name is Joy Maxwell. Um, I'm a midwife in Canada. Maybe we should start with that.
Yeah.
Just to piggyback a little bit, an internationally educated midwife from Nigeria, great country. I moved to Canada, and presently I'm practicing in Alberta, Canada, as a midwife. I've been doing this for the past 5 years in Alberta. I've done a little bit in Saskatchewan before I moved to Alberta, and yeah, but overall, I've been a midwife for the past 30 years combined. Yeah.
Wow. 30 years. That's a lot because honestly, when I look at midwives, I'm like, kudos to them because the blood, the pain, midwifery is one very emotional part of nursing that I don't think I can stand it. I'm not sure I don't have that liver to stand it. So, do you have any nursing background, ma, before you became a midwife? Any RM background at all? Any registered nursing background?
Yes, usually, in Nigeria, you have to have maybe a pre-program before midwifery, and some people just do midwifery straight. Yes, so I trained as a midwife. I'm also an RN from Nigeria. I did my certification here in Canada. So even before I transitioned into midwifery, I used to be a nurse. Yeah, I have a nursing background.
Okay. Thank you very much for that, ma. So we're going to go into the question. So this is the order of the day. I don't intend to keep her too long. So the order of the day is that I'm going to question her for like 30 minutes or maybe less. And then the viewers will have time to ask their questions. I know you have questions. You know the way we do it. I read out your questions, I pin it, she answer them. So roughly everything 1 hour. If you have friends that you think may benefit from this, send them the link to join us so that they can ask her the question in real time. But we want to spend just 1 hour here today because of the viewers that will be watching afterwards. Catching it, we don't want them to be bored because it's too long. So I already prepared my question. I'm just going to try to go through them. And I'm coming, please. So she's introduced herself to us that she's been practicing midwifery in Canada for 5 years now and overall for 30 years. But ma, how did you so for you, can you tell us your own transition? How did you transition to become a Canadian midwife? Maybe we should start from there. So when you migrated into Canada, how was the journey like for you before you now became a Canadian midwife? Maybe you can give us a rough of that.
Yeah, thanks. So actually, when I moved here, I came into Canada with the hope of coming to work as a nurse because in Nigeria, when I was getting all my information for migration, I didn't have any information regarding midwifery. There was nothing I laid my hands on. So then I moved here as a nurse. and then I did my exams, and then I started working as a nurse. Along the line, so I met one Nigerian midwife, and she talked about, and she was working already in Canada as a midwife, and that was how I got the information for the first time. So there wasn't really a lot of information for me, and then I started to Google, and then in 2014, so that's when I got the information. There's this program, we call it IMPP. It's for internationally educated midwives. And that was in Ontario. And that was the only program then that midwives, that was available for people like us that trained outside of Canada that we could use to transition. So I did like a follow-up. I contacted the school and then spoke to the director. They have like a process of admission process. And that program was housed under Ryerson University then, but I know they've changed their school, their name now to TMT, Toronto Metropolitan School, University. So, but then it was called Ryerson University. So they housed us, they housed the program. It was like a 1-year program. And then you have to do series of exams for you to be able to be admitted. So we did the application. Then after the application, I was selected. We were 25 people that were selected. And then we wrote the physical exam. And then after the physical exam, we did the OSCE part, which is the practical, the clinical part of it. And then after that, out of 25, they took 15. I was the only Nigerian for that group, because we also had every group, like every year there was admission. So we had midwives from all over the world, different part of the world. We even had medical doctors that were ready to transition into midwifery. They were also part of the program. Like in my class, I had close to about, I think 10 people that were medical doctors from other countries. So that's how we did the program. It was an intensive program because we have to do in class, in person. It's a little bit challenging because every week we had to write tests. It's very intensive, and but it's a good program for anybody trained outside of Canada. And then you see, coming from Nigeria, and then Canadian perspective of midwifery was quite different, was a little bit different, but it's the same midwifery anyways. It's just that there's a little bit of science, a little bit of technology, a little bit of a different kind of model of practice here in Canada. So I did that, and when I finished the program, I went for my 3 months clinical. I did a clinical placement for 3 months, and then after that, you have to write the Canadian midwifery exam. And it is after the midwifery exam, the Canadian midwifery exam, that you will now qualify. Then you get a license to practice as a midwife. Getting a job as a midwife, it's very, very easy. I will say that. I won't say it's easy because you have to make a choice. You have to work hard to be hired. But what is important is we need midwives in Canada. I tell you, the maternal health, reproductive health, we need more midwives. When I mean more midwives, I really mean more midwives. Yeah. So that's how I found myself. I did a little bit of placement in Saskatchewan, and then I got a job offer to join another midwife to pioneer a practice up north, and that is in Grand Prairie. So my first place I worked in Alberta was in Grand Prairie. I worked there. We started in practice because midwifery was new to that, to the community there. And then I worked there for, I think, about 3 years or so, 2 or 3 years before I now moved to Lethbridge, which is the southern part of Alberta. In the process, I also traveled to the Nunavut to do locum. I do locum in the Nunavut. And that's where I think we also need midwives. Like, my experience there was an eye-opening, and you could see the value of midwifery services, everywhere. One thing I want to say here, that IEN, I mean internationally educated midwives or nurses, should know is that nursing and midwifery are two two complete separate profession, and that will really help us to navigate. But somewhere like in Africa, we kind of mixed it together, but here in Canada, they are two different and their pathways are also different. But being a nurse kind of puts you in an advantage position because you are exposed to what is expected, you know, in being a midwife. Thank you.
Thank you so much. I was enjoying every bit of what you said. I was so engrossed. Like, I knew that I just had to get you to the YouTube channel. I just knew it. Thank you so much, ma. That was really comprehensive. And you said you went to Nunavut. That place is far. I got a job there as RN. I couldn't make it. It's 8 hours from my house. So that Nunavut she's talking about is like all this. When you say village in Canada, it's like the way the native live, they have less access to things. So if you're going to work there, it takes a lot of passion, it takes a lot of courage. So when she mentioned Nunavut, I opened my mouth because I know what it takes to work in that place. So well done, ma.
Thank,
That's really, really, really encouraging for me. Like really encouraging. Well done, ma. Well
thank you.
done, ma. So let's dive into the question now. Kachi, we're going to take questions, but we are going to ask her our own questions first before we take the audience's question. So that's how we do it. I'm just going to go into the questions now that I prepared for her. That was just a way to stall so that we wait for more people to join us, and more people are joining us now, so we can move. So currently today, ma, what are the effective pathways? Say I'm from Nigeria, from Ghana. I don't even know where to start. So at this stage of the Canadian healthcare system, what are the effective way for me to transition into the Canadian healthcare system as a midwife, as a registered midwife? Thank you, ma.
Okay, yeah, that's a good question. Um, it's a question that I want to answer like 100 times, because I think the more information we have out there, it's going to really help people. Because I think I'm going to be selfish a little bit. Nursing is just all over the place, and I appreciate what nurses are doing. I appreciate how we're helping to salvage Canadian nursing shortage, but I'm also calling on midwives from outside of Canada, Philippines, wherever, Mexico, Nigeria, Africa, general, we need midwives. And so we have limited pathways, I think, but there's kind of an awareness coming up. And presently, I know one of the focus in Alberta right now is how to increase workforce for midwives. And so we have different types depending on the province. So every province have their own pathway. But right now there are just three provinces, unfortunately, and that's so sad that we have just three provinces that are open to internationally educated midwives. And I would say two are technically more, they are like easier than the one in Ontario. So the one in Ontario is uh, that the one I went to has stopped. They don't do that program again, and that program will bring you into Canada. But the program they have now, which is being organized by the CMO, College of Midwives of Ontario, you have to be resident in Canada. So if you have any midwife that is resident in Canada, it's an opportunity for you. So, but if you're outside Canada, it's actually hard for you to get in through that program. Then the second program is the one by the British Columbia. And that's another province. And I'm just so grateful for that program, because that program could get you all the way from Africa, from wherever you are, from the UK, from Australia, into that program. And you can do it without you having a permanent resident, without you, residing here. The name of the program is IEMB BP. It's called Internationally Educated Midwives Bridging Program. And you can apply. You need to make some payments. It's about 8 months to 1 year program, depending on how you perform. It's kind of similar to what I did in Ontario, but the program I did in Ontario, I'm hoping very soon is going to start again, because a lot of groundwork is going on to see if they can start it up. But the one in BC is a very good program. that I will encourage anybody to do. You go online, and when you type in internationally educated midwives program in BC, and presently British Columbia is hiring, so don't even think about job offer because as soon as you're done, there are employers that are ready to hire you, and also to do all your paperwork in terms of your stay in Canada. And that is very good. It's something I will encourage anybody to apply for. So that program, the only thing I'm not 100% sure of is to know whether they have limits. I think they will have limits to admission, but presently there's also that pressure for them to hire midwives. There's shortage of midwives in BC, and the awareness is so high. The demand for midwives is high, and I will tell you, every day my wait list is going up. The numbers are going up. So there are so many, like the demand for midwives are high, and you should be open to working in rural places. That's one thing I would say. Be open to that. Um, it's a very good experience. It's a good place to start. Midwifery is midwifery anywhere. And if you find yourself in big city, good for you. But sorry, I'm kind of a bush person. I like, I enjoy what I do in the rural place. It's amazing. Yeah. And then we have, sorry, another thing, sorry, I got carried away. So the other program is the PLEA program. The PLEA program is the one we have in Alberta. So you apply to the College of Midwife of Alberta, you submit all your transcripts, your birth numbers, we do an assessment and make sure and see what your gaps are. And then when you have the gaps, the college will get back to you to say, okay, you need to do this, you need to do that. And then you figure out how to do your gaps. It may be because in Alberta, you have to be proficient in home birth, in hospital birth. So let's assume you have just hospital deliveries. The college may say, okay, we'll give you like a conditional license pending the time you complete your home birth numbers. So you look for a midwife that can precept you and like kind of supervise you to have those numbers. And as soon as you have the number, then the college will approve your registration, and then you can write your exam. You write the Canadian midwifery exams. That exam is done twice, in March and also in November. And if you also have like, I think, 3 chances to be able to write it. So those are the 3 pathways so far that we have, and we're hoping to have more. And the other pathway, another thing is for you to go back to school. So we have some universities here that train midwives. In Alberta, we have the MRU, Montreal University. We have McMaster in Ontario. We have UBC in British Columbia. We have McMaster in Ontario. We have it should be Ryerson, but now it's TMU, I think so. It's called TMU. It used to be Ryerson University. So for now, those are the universities we have. There's a program in Manitoba that I don't have 100% information about, and you can find out those information online too. In terms of, okay, I'll just wait for you to, let's get
Yes,
them there.
thank you so much, ma. Yeah, so for someone like me that do not have a midwifery background, so I hope we get what, let me quickly backtrack a little. We just ask her the pathways to transition as a midwife, that you already have your license from Nigeria, from Ghana, from anywhere. She has given us some provinces: Alberta, British Columbia, Ontario, that does this program. She also gave us some of these programs that run midwifery schools. MRU, she mentioned one also in I can't remember now, but if you miss any of them, you can watch. I'm also going to watch the replay of this program. So now I'm asking her, for someone like me that I don't have any midwifery background, and I'm the way I'm speaking now, I'm interested in midwifery. So what do I do? Do I go to the university to go and like register, like at that MRU, go and register for a midwifery course?
Yes. So if you just have like your nursing and you don't have midwifery background from Nigeria, good. As long if you're a nurse, we have one program, but it's only in Ontario that you can do it. It's a 2-year program. It's called nursing transition, or nursing a bridging program into midwifery. It's just 2 years, and that is done in Ontario. And it's also a good program. I've seen some of their graduates. In MRU, if you apply to MRU or BC, let's say you did nursing in here. I don't know if they're going to do like credit transfer for you and shorten the, if you had 3 years, if they can do like some credit transfer, they do if you were trained in Nigeria, sorry, if you were trained in Canada. But I don't know for somebody that did nursing in Nigeria, how they are going to do. But I tell you, MRU will take you. If you meet their qualification, you can also do, but I don't know how many years they're going to give you if you've done nursing before. But that pathway is also there.
Much ma. So let's there are some questions people are dropping that is relating to registered nursing transition in Canada. That's not why I'm here today. Today I'm here for midwives. After the program, if I still have some time, I can take some nursing question. But right now, no nursing question, just midwifery question. That's what we're taking right now. So the second question I have now is that, so for midwives that are already trained back home, is it mandatory that they must do the bridging program? Is it mandatory? Or there are ways that they can boycott the bridging program legally? Or is it mandatory that they must do bridging program to get into the Canadian midwifery system?
No. So it's not compulsory. Okay. They have to do the bridging program. So the program I talked to you about, which is the done in Alberta, is called PLEA, Prior Learning Assessment. Okay, so what they do is you apply to College of Midwife of Alberta, and then you submit. There's a form where you write when you graduated, what you're doing presently, the number of deliveries you've had, hospital birth, home birth, if you've done prenatal, postpartum, number of births every year, for how many years you've been qualified. You have to enter in those numbers, and then we want to see. Do you have? There's some qualifications that are very, very important. And then we even as a registered midwife presently practicing, I have to satisfy every year. And number one is the neonatal resuscitation program, the emergency skill work program, CPR. Those are core qualifications that you have to have in addition to what you're doing. So you don't have to do the bridging program. They will, so how it works is you apply, you tell them what you have, you send your transcript in, you send in your verification license from the Midwifery Council in Nigeria, and they will do, the registration committee will look at your application, go through it, and then give you a feedback to say, you have a gap in this area, you have a gap in this area, or you don't have a gap at all. So you're going to come in for what we call OSCE. OSCE is like is a kind of a practical, like a mock exam for you. We can say, okay, demonstrate to me, do this delivery, shoulder dystocia. There are some, things. How do you deliver twins? How do you deliver bridge? So those are the OSCE programs. Some of the OSCE programs they can ask you for you to demonstrate what you think you know. And so when you've done that, and then they clear you and they say, okay, now you qualify for registration. So that's not a bridging program. It's a PLEA program. But the one in BC is a bridging program. I'll call it more like a refresher program. But if you do the PLEA, then you should be able to try to upgrade yourself. You need to upgrade yourself in terms of knowing what is the expectations are, the Canadian expectations, and what you're expected to do when you get your registration, those kind of things. But definitely you need to do your NRP, you need to do your emergency skill. But don't worry about that. Finish your PLEA. When you come into Canada, then you can register for those programs and you can do them.
Wow, thank you so much, Ma. So now, do we understand it now? If you don't want to do the bridging program, you can do the PLEA program. But when you do that PLEA program, there are some certifications you will need to get, which you can still get, but do the PLEA program first. And something she said that is very important. If you do the PLEA program, upgrade yourself, because some nurses like me that we didn't do bridging program. I didn't do bridging program to become RN in Canada. They wanted me to. I said, no, let me challenge exam. So I challenged the NCLEX exam. I passed. And what she said about upgrade, you need to upgrade because Bridging program, they are lengthy, but they are very key to your practice in Canada. It refreshes your memory, your brain. It puts you on the spot. For people like me that didn't do bridging program, we have to do more. We have to get our like make sure you get some hands-on skills. Because other than that, if you don't know those things, it's a problem. So I had to upgrade, do a lot of hands-on skill, watch a lot of YouTube videos just to make sure that I catch up with people that did bridging program. Bridging programs are longer, but they are very beneficial if you can. So my best advice would be that if you know that my midwifery, I practiced for so a long time, and I'm not so good in this procedure, just go for the bridging program. But if you know that if I do the player program, I can cope with the Canadian system, do the player program. So assess yourself first, because if anything happens, remember your license is at stake and your reputation is at stake. So I think that's kind of solves that. The BC pathway and Abata pathway, which one is better to take? Somebody asked the question. I said the BC pathway and the Abata pathway for midwifery, which one is better to take?
Okay, both of them are good. Like I said, it all depends on where you're coming from, what you have. Both of them are the same. Even when you're done with the BC program, we've had some midwives that moved from BC to Alberta. Alberta still recognizes the bridging program if you are done with the bridging program. I also want to add that one of the certifying programs that you need to do is the fetal health surveillance. You also need to do that too. Sorry, I forgot it when I was speaking the last time. But yeah, either way is good. But you see, like Ife just said now, if you need like a refreshing, okay, the way we speak in Canada is different from the way we speak for people in different countries in terms of medical, healthcare delivery. Your language matters, and you need to learn all of that. So, but if you have opportunity for the BC, I'll say to go for it. If you don't, and you come into the midwifery program, when you are doing your supervised supervision time, if you have a good midwife that can help you for that 3 months, you may be able, if you are smart, you may be able to really fit in into Alberta pathway.
Thank you so much, ma. And somebody also asked here, as a midwife, do I need to write the English test?
It depends on your country, where you're coming from. Sorry, one of the things I missed with pathway is you need WES. You need to have your certificate evaluated for you to do both the player and all these pathways. So I missed that. But writing the English test depend on if you're a French speaker. Depending on, in Alberta, I don't think it's a recommendation. You need to check online and see what their recommendations are. But if you are from a French-speaking country and a Spanish-speaking country, you may definitely need your English test. And they also have, I think, I'm not sure right now for the BC, but when I trained, we also have English language course. So that is the benefit of doing this bridging program, where we also do the English course itself as part of our program. And, the use of language is very important. Yeah.
Thank you so much, ma. So we'll take a few more questions before we move back to the question that I've prepared for her. So if I want to, she already spoke about how to commence the bridging program. She already mentioned the school. So Jane, what I would advise you to do is to take your paper and pen, write down those schools she has mentioned, go to their website. Now check what are the requirements that I need. If you need to send them an email, you can send them an email to say, I'm in Nigeria, blah, blah, blah. I want to start my program, or what do I need? They will reply your email. She has given us good pointers onto the schools, the provinces. So what you have to do right now is to go there and now check. And she mentioned some of the requirements. So maybe you missed that. You can catch a replay later, because I don't want her to repeat herself again. She has mentioned all that because I remember that I heard all that from her. So you go to the replay. She will mention a lot of requirements actually. So you would if you do that, I'm sure you would be able to navigate yourself. I'm certified, but in Ontario, Canada, is there any bridging program? Yes, she mentioned Ontario, but I think she said they stopped the program. I'm not sure if I.
Yeah. So the program they stopped is the one that is housed by the university, by the Ryerson University. But presently, there's another program that is running by CMO, called College of Midwives of Ontario. If you go online, there's a program, they run it, it's very similar to the bridging program. And if you live in Ontario, please, I beg you to apply, for that program. Yeah.
I'm coming, ma. I just want to quickly answer somebody. So somebody is asking here about, she said she missed the bridging program encompasses. She already mentioned that. So I would advise that we catch a replay, just play it back when you are less busy after the show, so that we can, because I still have more questions for her, and I have only 1 hour. I don't want to keep her more than 1 hour because midwives are in high demand. I want to go and do midwifery herself, like as she's talking, because anything that is in high demand, you make more money from it. That's the truth. It's the truth of life. Anything in high demand, you will make more money. Nurses are everywhere. RN everywhere, RN everywhere. We don't even have job. Some nurses are looking for a job right now because there are too many nurses in Canada. Then they are doing the sponsorship program to bring in more nurses, and now the job is limited for them. But midwifery now, they are small, they are less. If you enter midwife now, they will grab you with both hands and they pay you more. They pay you better money. So honestly, I think I'm looking into the midwifery. Is there any other question here that we can quickly answer? So somebody asked a question about that. Do they take midwives? Midwives are they have only diplomas, or you have to have a bachelor's in all this bridging program?
Okay, good question. So the thing is, presently, I want us to know that what we have in Nigeria is what is required in Canada. So if you trained, I would just say Africa generally, especially if it's a post midwifery program, post nursing program, it's acceptable. It's the same curriculum. And when you bring your transcript and we do the assessment and you meet up, if there's any gap, they're going to tell you there's a gap. But yeah, whether we call it diploma or anything, as long as you have that, either post-nursing midwifery, because that's what I had, a post-nursing midwifery, or you did your 3 years midwifery, is acceptable. Yeah, for sure. In Canada, they do their own 4 years. But remember, the first 1 year is just like they do general sciences. And when you do your bridging program or your PLEA program, you are at par, like you're upgrading your midwifery program to be degree, the same level as people that went to the university. Yeah.
Okay. Thank you very much, ma. And then this, I don't know if they have practices since 2018. No, I don't think this one. Well, I don't think your year of practice matters. Does the year of practice matter I don't think it matters in the bridging program. I don't think it does.
Your assessment. So because you've been practicing since 2018, that's about 5 years, which is really good. We want midwives that are experienced. We really want new graduates if they apply, but you being a midwife since 2018 is also good, because what that means is you have experience with deliveries, and then you have to give us numbers of deliveries you've done for the past, for this 2018 to be able to assess you. Yeah, no matter how long you've practiced, you're still valuable.
So said, what about those that studied in the UK and have worked there as well? Is it the same route? Is there anything exempted for them because they studied in the UK, or is the same route they go?
The UK, the US, Canada, and Australia, we kind of have the same standard of practice. So most midwives from UK, when they transition so easily into Canadian standard, and so if you apply for the PLEA program is what I will advise you to do, because you may not need that bridging program because it's similar. You guys will do almost the same thing. It's the same standard. So yeah, UK will have an edge, kind of. Not really that they won't take people from other program, from other country. But if you have been practicing in the UK, then you have an edge. Your gap may not be too much. But what I want to say is, if you've been practicing in the UK and you're doing only hospital birth, then you also need, your gap will be for home birth. Yeah.
Thank you. I'm just trying to see. There is a question here I'm trying to pin for you to see, ma. I think the person is asking if they get paid. If they get paid during where is it? Okay, yes. Said, do we get paid during the bridging program?
You pay us for bridging it. So
also,
You don't get paid. Before, I think the one in Ontario, initially they were giving grants. It was just grants they were giving for the bridging program. But right now, no, you have to pay for your bridging program. And one thing I want to say is this: any cent, any dollar you spend, to become a midwife, you're gonna get it back. So yeah, it's worth it. That's what I would say.
That me, I'm always interested. Anything money. Do you hear what she said? Any dollar you spend, you will get it back. Any cent you that it is worth it. And she's had a Zoom meeting with us before where she kind of shared. We're still gonna ask her that question. Shared the kind of average the way you can work independently. It was so beautiful. And that's why I'm like, we have to bring her to the bigger stage to see. I think midwifery is really something to look into. I think we have I want to we Bukola, thank you so much for joining us. We have dealt with this your question. She expressly dealt with them, gave us guidelines. So our advisor after this show, just watch the replay. Everything is there. She mentioned a lot of pointers for us already. So I don't know. Do you have an idea of the price, ma, for the bridging program? Any idea of what it costs?
No, so if you go online, you know, go online, every detail you need is there, and you can call them, you can email them. They are very good at replying you every program, like every question. That's one thing, in Canada, we do that. So go online, find out, and that will be like a beginning for you. You may not get all the information from me today, but I want to arouse your interest. And so one step, how we know that you're really interested is when you make effort.
Effort. I tell people we did a program last month, and I tell people all the information we have shared in this room is not for you to go and keep it under the pillow. Is to work at that information. That is where you become successful. We work at information, we get information, we work at it. So we, like she said, you will not get everything today, but that interest will be there. The pointers are there, the leads are there. So what do we do after? We follow the leads, we follow the pointers, we email them, we call them, and that's it. And then we can attain our good success. So let me quickly get her to answer some of my questions here before we go into the audience's question. So I said, we are aware that midwifery can practice independently. So can we dwell on the business angle of midwifery? I mean, owning a practice in Canada, managing it, the prospect hearing, and how does that look like? What's the framework for that? If I want to become independent, I know you told us sometimes that midwives are independent. They can give orders, they can write orders, they can. I don't know how that works. I don't know if they need to get a certification to be able to give orders, write orders, and all that. So how does it work? The business angle. I want to establish my own practice. I want to employ people. How does it work? The business angle of midwifery in Canada. Thank you, ma.
Yeah, thanks. Good question. So midwife can work in two models. We have employee model and independent model. Okay. So employee model is when it depends on your province or what you want. Employee model is when you work for government. So when you work for government, they hire you as a midwife. Even though you are under employee model, you are hired, you are still an independent care providers. So midwives are not, they don't work under doctors, they don't take instructions from nobody. We're specialists, we're low risk obstetric providers. So you see your client, so I would just kind of go back a little bit. So what do midwives do in Canada? We're independent care providers. We take care of pregnant women from when they are pregnant, during labor, postpartum, when they've had their baby. We take care of them and their babies where they are care provider, we call it MRP, up to 6 weeks to 8 weeks postpartum. And that's when we discharge women from care. So when you are an independent care provider, you have a clinic space where you see your client once every week, depending on their gestational age. You see them, you do the assessment, the assessment during pregnancy, you do all their checks, you order labs, you order ultrasound. And as a midwife, you should be able to interpret results for those ultrasound and the labs. You, as a midwife, you're expected to know normal and abnormal obstetrics. We also do consultations. So when you have a woman under your care and there are complications, as a midwife, you should be able to identify it and do referral as appropriate. You do referral to other care providers, and then you also see women during labor. So you manage their labor. You do the delivery of the baby. You go home to see them 24 hours after they had their babies. You see them the first 1 week. You see them in clinic at 2 weeks, at 4 weeks, and at 6 weeks. So you are doing that on your own, based on your knowledge and based on your certification. There are also some other things that we do in some provinces. Some midwives do IUD insertion. You can do tongue tie revision for babies and all of that. And we also do newborn care from birth to 6 weeks. So basically, that's what you do as a midwife, whether you are under the employee model or you are under the independent model. Independent model means you are a business owner. You are a self-employed. You can decide to do that, or you can decide to be hired by the government. There are some provinces that do only employee model. From provinces like Manitoba, Saskatchewan, Nova Scotia. In Alberta, you can do either employee model or you can be by yourself. Okay, so now how it works is a group of midwives come together and they have a practice. I'm just going to use myself as an example. So I have a practice, it's called Chinook Midwives. So under that practice, we have other midwives that will work together as a team. And they are responsible for the care they give. And I am not their boss. I am just the practice lead, like an overseer for that practice. And that's how we work as midwives. So something that is close to how we work is we work like family doctors. But the thing is, we don't see sick people. We only see pregnant women, and we provide care. And if a mom is seeing a midwife, she doesn't need to see a doctor. So you can either choose to see a doctor or you see your midwife as your care provider. So maybe I should go back to the business part of it. So as
Okay,
a
sorry, ma. Let's just quickly take this before we go to the business. I would remind you. So somebody said for the employee model, do you work with others?
Yeah, employee model, you can have a team of, so employee model, you have a practice. That's what we call it, like a clinic practice. And you can have 5, 10 midwives, 20 midwives, 2 midwives, 3 midwives together working in a practice.
Okay.
So you can have like a fair midwifery practice, and you have like 5 midwives in a fair midwifery practice.
Mm-hmm.
Okay. That's whether it's employee, whether it's independent. Okay, the difference there, we work the same way. So let me just say that generally in Canada, midwives work as independent care providers. Okay, we make decisions, we make health decisions for our client, we provide health information for our client, we monitor them in pregnancy, at birth, and also postpartum. We take care of them generally. So that's what midwives do. Okay, what makes you independent or employee is how you are being paid. So if you're an employee midwife, you are being paid by the government or by whoever employed you. But if you are independent, you are paying yourself. So we are contractors. Let me just put it, we're contractors to the Ministry of Health.
Somebody say, which of the two models do you advise?
It's your choice, though.
Yeah, absolutely.
There are benefits to all of them. There are benefits. When you have your own business, you are on your toes, right? But if that business is owned by another person, the way you're going to manage that business is different. So, but it's your choice. Both of them have benefits. They have different benefits. For tax purposes, if you're an independent provider, you do your tax by yourself. But if you're under employee, the government takes their tax. Like they will do the taxing for you. Independent model. Also, you need to work hard to build an image for your practice. I'm not saying you shouldn't work hard when you are employee, but you are just by yourself and you're managing. It's a lot because all you know is midwifery, and now you're a business partner. You have to talk about your privacy assessment, your impact assessment. You have to talk about getting computers for your clinic. You have to get a clinic space. You have to hire your admin. You get an admin. You hire cleaners and all of that and all of that. So it's a lot to have a practice. Okay, you have to do all the hiring yourself. You have to run it as your business. But if you're an employee model, you just do your midwifery practice and that's it.
Thank you very, very much. But honestly, this information in this live show, if I were you, I'll just sit down, replay it, right? Because even me, that I'm the host, as the host, I'm just speaking, I'm not, but I love it when I'm able to flow with her, I'm connecting with her. So let alone people that are watching that are not, we are not coordinating this event. So if you miss any part, just me too. I'll replay this thing back again. I will take my jota because it's like this beautiful day. RN, everybody's RN now. If you want to be distant in life, you need to do what others are not doing. That's the only way to be distant in life. And if you want to be distant, midwifery is not very saturated according to what we are hearing now. So you want to do what? Pick this information right now. So Ma, you are going to tell us about the business model. Before I cut you short, I don't know if you can pick from that angle again. We're talking, tell us about the business model.
Yeah, so the independent practice, like I said, every midwife, if you are going to be under the independent practice, you are working for yourself. So, number one, you have to get the name of your business. Okay. So I'm going to do a little bit of explanation here. So a practice owner owns the practice. She owns the clinic. She owns, she will do all the ordering, the supplies, the clinic supply, and all of that. Then the other midwives that are working in that practice that are not practice owner, they are also independent. Okay? They are subcontractors. So the practice gets the contract from the government, and then the other midwives, she will sublet those contracts to the other midwives. So in very simple term, what it means is for all the women that are pregnant that you're taking care of, the government is saying, hey, we're going to pay you to take care of 40 women every year that are pregnant. This is how much we're going to pay you. And then you are paid for that. Okay? And if you're a practice owner, you can't see all these women in this, it may be 200, 300, and then you get other midwives that want to work in the same place with you. And so this midwife take care of these moms, but you are not their boss. They are also independent subcontractors. So as a midwife, you either choose to incorporate your business or you go into small business. So if you incorporate, you get a name, you register your business, and then you start to work. The money you get goes into your business account. Whatever you do with it is your business. You use it to run your business because you are also going to do home birth. You're going to get supply for yourself. You're buying equipment. You have a fetoscope. You have your oxygen cylinder. So for every midwife in Canada, when you open our trunk, you're going to get equipment that is equivalent to a level 1 hospital in Canada. So you're getting medications, IVs, delivery sets, sterile equipment, resuscitation equipment, suctioning. Everything you will see in a level 1 hospital is inside my car, or any midwife, any registered midwife. And that costs a lot. And then you are going for home visits. You're driving 2 hours, you're driving 1 hour, you're driving 30 minutes. It may just be 10 minutes drive just to visit those women at home and to do the follow-up. So that's business. So you're going to be paid for your mileage. You're going to be paid for those equipment. So that's why it's like a business, that you are running. And then you also pay yourself. You have clothes that you wear to go to work. You also have to pay for it. Your uniform, if you want to be on scrub, depending on what your choices are. So medication, that you do and all of that. And your equipment, they get old, you have to replace them. So every midwife is a business woman.
So for the business angle, ma, and when I want to start, let's say I'm now ready to start the business, does government give me any funding to establish my practice? At least I will have a clinic that they come to visit me, they come to check their babies and all that. Does government have any funding for me, or how do I get money to put on the practice, to pay rent, mortgage? So is there any grant anywhere that you can leverage?
Yeah. So in some provinces there are grants for clinic practice. Yes. Some provinces do provide grant, while some don't. And so, but you have to do what we call self-sustaining. So there's something we call the admin fee that you use to run the business. Okay. So those are the ways that midwives can get funds to run their business. Presently is not great. Some provinces are doing better than the other, but you also have to run your business. I think every year the midwife see every year or every 3 years, depending on the contract terms. When the contract terms is due, then you have to do negotiation. You have to go into negotiation again and talk to government. Every healthcare provider feels underpaid and underappreciated, but conversations are going on regarding upgrading the pay and compensation. So yeah, those things are taken care of from what you get. Yeah, they may not be enough. They may not be what we want it to be, but we're still doing the work. Yeah.
Thank you, ma. So somebody said she wants to join your model if you are going to hire a midwife. So if you need if you need to hire a midwife, she said she would like to join your practice.
Yeah.
Um,
If she has a license in Canada, yeah, you're welcome. We need.
yes, if you have a license in Canada, but I don't think she has a license in Canada yet.
If you have a license,
Do you have a license in Canada yet?
I will hire you like right now.
Just imagine that. If you have a license in Canada, she's going to hire like right now. Somebody said I'm in Ontario. Can I get your email? Honestly, blessing. I don't know you or something, but I would say this might not be sustainable. Imagine if everybody, we have close to 50 people on this live, want to get an email. That would be too much. And she's a consultant herself. That would be eating into her time. So I would say the best way is to watch ahead. Go and watch, look at the schools. You can email the schools. That's part of their job, to give you responses. You can email the school, you can email the pointers, but this one is not very, very sustainable. It's not very sustainable. Somebody else is asking, what are the criteria to employing the international midwife? I don't think they employ international midwife from Nigeria. I don't think they employ them like based on sponsorship or something. I think you have to find your way here first and then navigate your way. Do you have any input, man, on this?
Yeah, the pathway to employing international midwife is you getting license in Canada. As soon as you get your license in Canada, you get hired.
You see, as soon as you get license, you get hired. So do we understand? We have discussed about the business model and if you are going to be working under somebody's model. Is there any other question I'm missing from that business model that I want to? Yes. So for the pregnant women, you mentioned that the government will pay for money to take care of these pregnant women. Do they pay all the money? Like, for example, if we need, say, $20,000 to take care of 2 pregnant women, do government give us the whole $20,000 or they give us 15 and the women have to pay the remaining 5?
No, so midwifery care is covered under the healthcare, free healthcare system. So just like you go to see the doctor and you don't get paid, it's the same thing. If you have your Canadian or any provincial health card, it's covered.
Okay.
Women don't pay for any. They don't pay for midwifery care. It's free as long as they have the healthcare number. Sorry, their health card number.
Healthcare card, yeah.
Yes. So if you're in a, if you have another health card, that's covered. But if you don't, or like we also once in a while we have women that travel. We call it birth tourism. So women travel from outside of Canada.
There's travel midwifery too. Wow.
Yeah, they come to Canada to have their babies. So when that happens, they have to pay out of pocket. So they pay midwives for that care. Yeah.
That's true. Yeah, that's true. That's true. People come to. Okay, so if that happens that a woman is coming from Africa to have a baby in Canada here, she's not registered here, so she pays the midwife. That means any money she pays goes into the midwifery practice, not to the government, right?
No, it goes to the woman. Yeah, it goes to the midwife.
To
Yeah,
the midwife, to their practice.
yeah.
Okay, okay. So that means the practice build the woman independently.
No, so when you say practice, so like for example, we can have three or five midwives in Ife midwifery clinic, and when somebody comes from, let's say, the Philippines and she wants to have a baby in Canada, she goes on our website to say, okay, I'm going to read everybody's bio. I think I prefer Ife as my midwife. And then she will choose the midwife. And then when she chooses the midwife, you approach the midwife. Okay, so how much is your midwifery care? And then you give her the bill. She pays you. She doesn't pay the practice. She's not paying the clinic. She's going to pay you. Yeah.
Okay, that's another angle of it. I'm already thinking of if I become a midwife, I'll be making content to say, come to my clinic to have your baby, to have your
Uh,
baby in the clinic.
um, Taking people from outside of Canada is being regulated. You
Mm,
have to make sure you are not denying Canadian citizen of the care before you take somebody from outside. So it's not really, we don't do a lot of that, but we put Canadian
first.
citizen and residents, we put them first.
Mm.
But once in a while, we have these women that are, they need better care and we attend to them. Yeah.
Somebody's asking if your practice is in Ontario.
My practice is in Lethbridge.
Okay.
It's called Chinook Midwives. It's in Alberta, Lethbridge.
Okay, ma. So let us talk about how much averagely a midwife can make in a year. Like averagely, what can a midwife make in a year? If they are, let's say, when they are employed in a facility and if they have their own practice. Please note that money matters are always very sensitive. So that's why I said averagely. Like it's going to be like an estimate. It won't be the exact. So if I'm employed under a practice, how much can I make averagely? If I'm employed as a self, I'm doing it on myself. I have people that are also working with me. I have my own practice. How much can I also make averagely in a year?
Okay. So I'm going to answer that question without kind of giving a lot of information, but averagely midwives are their compensation. I would say for now they are they are well paid. Okay. But like I said, negotiation is underway. We're still talking to government for better compensation. So averagely, it depends on how much you can do. So because you are independent, I'll kind of explain a little bit before I kind of give like a figure. Um, you can decide to say, for the month of April, I'm going on vacation. Take 2 weeks off, maybe to the Bahamas or that kind of thing. I'm going to just have two women in care, and that's your choice. So that's why it's independent. You can say, you know what, this month I am very free. My kids are on vacation. I need 10 deliveries, and then you go for it. So, um, ideally, for you to be able to maintain your certification, you need between 30 to 40 deliveries every year. Whether you do less, if you do less than 30, you are considered a part-time midwife. But women that are midwives that are doing 30 to 40 are considered full-time. And then you maintain a full-time license to be able to do that. Okay. So it depends on how much work you want to do. Do you want to go maximum? Do you want to do minimum? But your take-home pay, midwives can take between 10 to 15 grand home every month or more or less. It varies on you. You decide how much you want to get paid. You can get up to 40,000 a month if you want. It's your choice of how much you want to do. So yeah, that's what I'll say.
You just said now is for people that have their practice, right? This range you just gave us now.
This is for midwives, practicing midwives. And I'm using Alberta.
Okay. Practicing midwife in the sense that they have their own practice, right? They own their own practice, or those that are working.
Registered midwife.
Okay, registered midwife, like that do not run their own practice. Or
So
that,
you running your practice does not make you different.
oh,
You
okay.
are
Does
like,
it make me richer?
no, it doesn't make you richer. It just makes you a, we call it practice lead, business
Mm,
owner.
okay,
Okay.
true.
You just
Having a
oversee.
business does not make me rich. That's true, because I have a business and I know that is a lot of work.
It's a lot of work. You're just like a manager. You're
Yeah,
managing the practice. But you cannot say, because I'm a practice owner, I'm not going to do any birth. The midwives will do the birth and I'll earn the money. No, it's not done that way. You have to work as a midwife and also work as a practice owner. They're two different, it's a lot of work to do that. You understand? But, you know, um, with as time goes on, you kind of figure it out that you're doing a good job as a practice owner. That's the way I see it. So, but I'm talking about registered midwife on the average now. You understand? In Alberta.
I understand now. Thank you so much. Somebody asked a very valuable question here. Said, how do we get the pregnant women, or is government that send them to the clinic?
Good question. So, we have a website. So I'll use Alberta for example, and I think in other provinces that's what we do. We have Alberta Association of Midwives. It's a website where you go to and you say need a midwife, then you click and then you apply. It will ask you some question, your name, your health card number, number of deliveries. Is this baby number one, baby number two? You choose, and then you say, okay, where do you live? You write where you live, and then if you have a midwife preference, do you want Ife? Do you want Joy? You click the name of the midwife you want to. And even if you don't know the name of the midwifery practice, the midwifery clinic, you click, if you put your area, it will show you the midwife practices in that area. And then you will apply, you submit your application. So I go online and I see your application under my practice. And then I apply, I will look at it and see, okay, she's due in May. Do I have spots in May? No, I don't have spots. Then I don't take you. Yes, I have spot. Then I'll take you. Your phone number is already in your application form. We will call you on the phone. We will invite you for an interview to check, to look at your health history to see whether you fit. And I will want to say here that midwives only take care of low risk pregnant women. We don't take care of high risk. High risk are being taken by obstetricians. And so, depending on what your health assessment is, we will determine whether you are low risk or you are high risk. If you are low risk, we take you into care, and then that's how we take women. The other way that women can access care is if you go to our website. So all the clinics, we have websites, and you apply. You just say apply for care, you apply. You can also stumble over our phone number. We also have our phone number, our contact number on the phone. You can send us an email. You can also call and say, hey, I want a midwife. And then that's how people come in. But we prefer application, but people that are desperate will submit application. They will also call because they really need midwives. And you can walk into the clinic if you're lucky. Some people walk in and say, take me. And that's how we take people. But definitely it's online application. And we also get reference from doctors. Some family doctors also refer, they refer patient to us, to midwives. Yeah.
Yeah, so I have a quick question. So I know I have had two babies in Canada now. And so each time I usually start with my family doctor. Then from my family doctor, I get referred to my gynecologist. I use the same gynecologist for the two babies. So in that instance, can I make a choice to say, okay, I want you to refer me to, and the gynecologists, are they also, they are doctors, I know that. But can I make a choice to say, I want you to refer me to a midwife this time? I don't want you to refer me to a gynecologist.
Yes. You can either get your doctor to refer you or you can self-refer.
Okay.
Self-refer is when you send, when you go online and you apply or you call the clinic. Okay. So that is self-refer. Then at times you can ask your doctor to send you. The reason why your doctor is referring you is that they don't do birth. They don't do care. And then obstetrician, like I said, at times they take in low risk patient because we don't have enough midwives. If we have enough midwives, OBs are just there for complicated cases, complicated midwifery, complicated obstetrical cases, and we refer to them. So we do referral to them. We do referral to surgeons, to medical medicine specialists. We do referral to psychiatrists, mental health, a dietitian, depending on what the situations are. So we do all those referrals. So I would say you can self-refer, and yeah, even before your doctor. So we start to see women from 8 weeks. But what happened is that some people, the moment they pee in the cup and it's all positive at 5 weeks, they are calling and say, "Hey, Joy, can you take me?" People come in as early as 5 weeks, but we start seeing them in clinic from 8 weeks.
Thank you very much, ma. Somebody is asking us flexibility. How flexible? I'm sorry, ma. Please, everybody on this live show, we have close to 50 people here. Over 50 people have been going in and out. Like this live show, that would make YouTube show it to more midwives. So like it, like it, like we need more midwives in Canada, and you can help us achieve that. Just like it, click on the like. That way, YouTube will show it to more people. But if you don't like it, YouTube will say, that's it. The people don't like it. So you have to like everybody like it. Just click on the like, keep liking it so that YouTube can show it to more people. So somebody is asking of flexibility. How flexible is me? Because RN is not very flexible for me. I'm doing 12 hours job. I have 2 children. I have family. It's not very flexible. That's the truth. Except you want to go into casual. That's for RN. I can't talk about midwife. For RN, if you are casual, you may have some time. But if you are full time, it's a lot. I mean, full time, and it's a lot for me. So let's talk about flexibility, ma. Thank you so much.
Yeah, flexibility. We're coming to that. There's a lot of new thing happening with midwifery. For example, somewhere like in Ontario now, I think they are leading. They have, we call it expanded scope, or you can call it alternative care model of midwifery. That you can decide to say, you know what, I don't want to do birth. I just want to do prenatal. I just want to do postpartum. I want to focus on maybe postpartum and newborn babies, And we also have some people that are doing just hospital care. They just in the hospital to do assessment for women and to do deliveries. So it's changing, but it's also challenging because the model of care for midwifery in Alberta is, sorry, not in Alberta, in Canada generally, is what we call continuity of care. So continuity of care, like Ife, you said the last time you were seeing your doctor, he transferred you to an OB. And no, that doesn't happen with midwifery care. We start to see it from beginning. We build that connection, the relationship, the trust, and then we keep seeing you throughout your pregnancy. We already understand you. We know what you want, what your expectations are. And so that makes us a better person to support you in labor. And so when you go into labor, I already say, okay, she has a birth plan. This is what she wants to. And then you see, the experience is different. And you are done having a baby. Then I come to see you at home. I'm seeing you at home. Postpartum, what we discussed when you were pregnant, I'm using those information to support you in your postpartum. So you see, continuity of care is our focus for midwifery model in Canada, and it kind of gives a better outcome for obstetrical care. So, but it's demanding on the midwife now. So that's the whole full package that we offer. Right now, flexibility is also coming in terms of we can say, you know what, we're just going to be 6 midwives. And we'll pull all our clients together. Let's say we're 6 midwives. You have 5. I have 5. And 6 of us are bringing in 5 clients together. Okay, we call it shared care. 5 times 6 will be 30. Right?
It's 30, ma. You're right, ma.
Okay, so we bring in 30 clients together, and then we have a call roster. So you say, okay, Joy, you'll be in clinic today. You are doing clinic this week. Okay, Joy, Ife, you'll be off. Mary, you will be the one on call for deliveries. You see, that is flexibility. So we do what we call rotation. Okay, one person is in clinic, one person is on call, one person is doing this. So that's one model. We call it shared care model. The other model we also do, which is part of our flexibility, is solo. So solo midwife is you alone. You say, okay, for the month of January, I just want to see 4 women. And you take care of your 4 women, you do their delivery, you are always on call for them. Nobody else is helping you. And you say, okay, in May, I'm going to be away. because I'm going on vacation. So for the month of May, you don't take anybody. So that is solo. So that's flexibility. Okay. So that is the flexibility that we put in, that that come. It's either you are in a, and it's your decision. Nobody will force you. You can say, okay, I want to do a shared care model, or I want to do a solo uh, care model. So it depends on what you're choosing to do as a midwife. Okay. And you can, we're getting to that in Alberta. We're still doing our continuity of care, COC. We have just one place we're doing hospital midwifery, where you're just maybe on call for 3 days, you take 3 days off. If you don't want to see women in clinic, you don't want to do all this COC kind of thing, you can just be in the hospital. We are not yet there, but I think Ontario, they have a lot of model. They are flexible. And I think BC too. BC is coming, and Alberta, we're coming up there. So we can accommodate people that are getting old like us and trying to work towards our retirement. We can have either prenatal or postpartum, or you're doing deliveries alone. So yeah, that is the flexibility we have for now.
Since you mentioned about province just now, somebody asked which province is easier to join the midwifery practice. So I don't know if you want to just quickly touch base on that. Though for me, I think every province has their work. You have work to do in every province. You have the models, you have the pathways, just have to follow through. But I don't know if maybe based on your advice, if there's anyone that you feel that might be easier to, begin the midwifery practice there.
Yeah, because I'm biased and because I live in Alberta, I will say Alberta.
I'm always choosing Alberta too. Team Alberta.
Yeah. The other thing is the somewhere like Nova Scotia, Newfoundland, those places, they need midwife. I don't know whether they are up to 5 midwives there. So where they need people, they are going to give you more support. So you can also go to those provinces, but they are employee model.
Thank you so much, man. There is yes, actually, midwifery is very deep. Midwifery is very deep, and it's very interesting. It's just that blood. I don't know if I can stand all those blood.
You're a nurse. You should
Oh,
be.
the last time I was in the delivery room, I ran out because the blood was so much for me, and it was all over in my face. I'm like, oh my God, to come! I ran out. So the blood, no, I'm a nurse, but the blood I see when I do wound dressing is small. Midwifery blood is like the blood is a pool. So that blood part, I don't know how to cope.
Yeah, the blood you see is not just blood. There's amniotic fluid in it. It's not just blood. It's a lot in it. Yeah, it's midwifery. It's deep. It's good. Yeah, it's good. It's very rewarding.
Somebody asked this question. I think it's important too. So she's asking if when you want to start practicing now, do you need to get your RN license first, or it doesn't matter? You can just go for your bridging program, get your Nigerian license, or do I need to get a Canadian RN license first before I can now become a midwife?
No. Like I said, RN is registered nurse. It's a different profession, like 100% different from being a midwife. You don't need RN before you go become a midwife. Okay, but if you're an RN in Canada, you can transition into midwifery using your RN license and your RN training. But if you are coming into Canada and what you want is midwifery, go for midwifery.
Just go for it straight. If I think this midwifery is because because this midwifery might be because as an RN, I'm thinking of becoming a nurse practitioner. Before I become a nurse practitioner, I need some hours. And the nurse practitioner are not able to independently have their own practice yet as of today in Canada. As far back as information I have, you can have a practice, but that means you're going to have you're going to have a doctor there as maybe from what I heard, I don't know, as the CEO, something like that. Then you are going to be part of the board of directors, something like that. But for midwifery, you can kind of just set up your practice and you are independent that way. Than even when I become an MP, I'm not able to have a practice like this is my practice and it's under my name. I don't think anybody that's been able to do that as a nurse practitioner in Canada, as far as I know. Somebody said, I'm a midwife. Yes, we have talked about all this, Miss Akitayo. So I will say that Akitoye, sorry, I will say that you should check the replay. Which bridging program did you complete? Is it nursing bridging program or RM bridging program? Which one did you complete? Is it RM or RM bridging program? Which one did you complete? And for the solo, will I be getting paid if I decide not to work for that month? I think we've passed this, but I don't know. Do you remember this part, ma? Because we've
Yes.
passed.
So that question, you get to answer it yourself. So if you are solo and you didn't work for that month, you won't get paid. But you see, you're not only getting paid for your delivery, remember? You're getting paid for all your clinic visits, your prenatal and your postpartum. So your pay is continuous. The only thing is you don't have any delivery for that month because you're going away. Because if you have a delivery for a month, you have to be in town. You have to be available to do deliveries. You have to be on call for them. The where this one is applicable is if it's a shared care and I'm like doing 1 week on, 1 week off. So you get paid every time. Even when you travel, you still get paid because your other colleague, your team members are working for you. And when you come back, you will work for them, they will go on vacation. So it's a cycle. Yeah, you can. So shared care gives you like a kind of balanced lifestyle, but some people prefer solo. Presently, I'm doing solo. I've done shared care before. I'm doing solo. I would like to be shared care again. I love shared care. Yeah.
Yeah, I think I love that shared care too. If you have people that are like have good team spirit like you do, then I think it's going to work out so well. Because sometimes you can try to take your break and they are working, when you take your break, I'm also working. It's really beautiful to see people coming together. So what are the perks of practicing as a midwife that may be missing if I decide to practice as RN? Like the advantage of being a midwife over just being an RN in Canada. Like, are there perks? Are there advantages? Are there juicy part of the fact that I'm a midwife compared to if I'm just an RN? Like now, I'm just an RN. I don't have a practice. So, are there perks of being a midwife over being an RN?
Um, to be honest, I value what nurses do and what they bring in. It's really hard to compare because we're in different profession, right? And I also want to say that in the hospital, like when we do hospital deliveries as midwives, nurses are uh, they come in handy, right? They are the one that support us with medication and child care, the newborn care, like right after. If there's resuscitation, we're calling the NICU team to do resuscitation and all of that. So nurses, I value what they do. They support us. At times in the community, we hire nurses to work for midwives for backup, in the community. So while I have to talk about a little comparison is if you have both certification now. That's why I'm going to talk about it. But otherwise, um, nurses are as valuable as midwives, as doctors, and every other care providers. So, but if you have both certification, for me speaking personally, I'm a registered nurse and also a registered midwife by practice. Sorry, by education, by qualification, and all of that. But what I see is that nurses, you are into so many things. So you go medical, surgical, obstetrics, you are into so many things, right? And so um, there's a lot of pulling here and there. The demand on nurses is a lot. But when it comes to midwifery, there's a focus. I'm just focusing on obstetrics. I'm focusing on pregnancy. I'm narrowing it down. So it helps me with mastering and professionalism. Um, I'm focusing on one thing. So that's why I decided to say, you know what, I'm going to slow down on my nursing um, qualification. But you see, those skills I have acquired as a nurse, they are also handy for me as a midwife, right? Like if I'm asking the nurses to set up line for a patient and they are very busy, that kind of thing, I can step in and set up my line because as a nurse, I've done IV insertion and all of that. So nursing midwifery is more focused. And you see, watching this miracle of life every day, it has a different impact on you. And I think that was why I decided to quit nursing I worked in a place, palliative, where you get to meet client, you're building bond with your patient, and the next time you are coming to shift, their bed is empty, like they are in the morgue, like they passed away. And you know the impact is so much when you work in places like that. And it got to a point in my life where I said, you know what, I'm not going to do this anymore. And that was one of the things that inspired me to transition into midwifery. Seeing life every day being born, and those precious gifts coming out, they come out floppy, and before you know it, they take in their fresh air and they're crying beautiful, and the joy at times, the mom is crying, the midwife is crying, everybody's crying, and it's a good cry. It's a cry of, that now I'm a mother. You see people's name being changed. If families are being, their lives are being changed just because they have a child. That passion, that is what drives me. That's why I wake up every morning. I want to do midwifery. I want to talk midwifery. It has a different impact on me. Not to say that people that are into palliative are not valuable. They are very valuable, but it depends on what is your passion driving you into. So if you have a midwifery license, um, it's worth it to see if it's something you will like. Do you have passion for it? Like if I was saying something about blood and all of that, at times, yes, that blood can be scary. But you see, when you anticipate life coming, you don't see the blood. You just, you see more of, it's a lot of joy, when you work. I love what I do. It gives me joy. The work is hard. It's really, really hard. It's not just a walk in the park, but I tell you, what drives me is the joy it gives, the experience that this mom have, and they tell their birth stories. And, that's what keeps me going. Thank you.
So much, ma. Thank you. But this YouTube life is so interesting. I don't want it to end. Somebody said, can someone with RN license in Canada work as labor and delivery nurse in Canada before they even have their midwifery license?
Yes, 100%. Yeah. If you
Yeah,
work in the
I do midwifery at work.
Yeah. So if you're into public health, some public health nurses, they do postpartum for doctors, they go for home visits, they do immunization and all of that. Yeah, you can work. Those things can give you experience, right? Some nurses, we have a lot of nurses in labor and delivery. It can also give you that exposure too, you know. And most of the nurses that I've seen that came into midwifery are nurses that were from labor and delivery. And many years ago, there was this program, uh, Alberta Health did it, where they were encouraging more midwives to transition into midwifery because we needed more midwives. And so I have some of my colleagues that were labor and delivery nurses that came into midwifery. Yeah, it's valuable.
Thank you so much, ma. So for this, I'll just input something. So for this, currently now I don't have my NRP yet. So I'm always a modern nurse. Like I'm the nurse to the mom. I cannot be a nurse to the baby because I don't have NRP yet. So you need to have some certifications. Like when you have your NRP, you can now become the baby nurse. That means when the baby comes out, me, I'll be there. I'll now pass it to the nurse that has NRP to be the baby nurse because they have to resuscitate and all that. I don't have that certification yet. So you can very well work in the labor and delivery system. My hospital organized a training for us in I think that is what's the name of this place? I've forgotten the name. Grand Prairie. So we were supposed to go, but I've not done my own. We're supposed to go there to watch midwives for 2 weeks, I think. Watch midwives, get some training. So those are the things that AHS will give you if you're under age. I don't know for other private, but for AHS, they would give you most of the trainings you need. But it also depends on how many people in the unit want to go for that training at that time. So
Also, that's a good program. Yeah.
I don't know if she's on. I don't know if she's on LinkedIn. I don't know if she's on LinkedIn.
Yes, I am. Yeah.
Okay. So what's the name of LinkedIn, ma?
I think it's Joy Maxwell. Let's see.
Okay, let her check for us and then I'll pin it.
Uh,
Victoria Ada. Oh, I'm sorry if I'm
Joy Maxwell. I'm on LinkedIn. Joy Maxwell.
Joy Maxwell on LinkedIn. We have answered this question. So if you can watch a replay, the replay of this show will be available immediately we finish. So you can watch a replay, watch it. This show, as in, is so interesting that I've gotten so many, and it's so it stirs my interest. Even me that I'm saying blood, 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 blood. It's stirring my interest in a way that I feel like, oh, maybe this will phrase because it's actually exciting if you look at it. We lose so many people in the acute care. I work in acute care ER right now. Every time somebody is dead, you're like, where is the patient dead? Where is the patient dead? But midwife is not like that. You are bringing forth life. I think it's not like they will not have some issues sometimes, but it's less compared to what we experience in acute care. And the fact that we have no job description in acute care is killing me. It's killing me because the cook will come, they bring the food. And I was asking again to a colleague, and I said, why would a cook come bring the food and you cannot open the lid of the place for the patient? You are the cook. I'm not a cook. I'm just a nurse. And then the patient will ring the bell to say, I need help with I have to go there to open their list for them. I have to prepare their tea. I have no job description. I do everything at work. But as a midwife, you are streamlined to this is what I do, and that is what I do. Not like you will not help mother sometimes to maybe make their tea or something, but not all the time. In the hospital, I'm the ATA, I'm the doctor. The doctor sometimes will not come to see the patient. I have to be calling them 5 times. Are you not going to come and see this patient? Because everything is on us. But nursing is interesting. We just have to find our part. Mo Consult says something, we need to find our part, and that's it. Well, if you want to become a mentee, you know me, I will not ask somebody like this want to become mentee. I'll just go to our LinkedIn, I'll go and be following her, I will like her post, I will drop comments, she will notice me, you will build your conversation from there. So that is how me I do it, Sha. If I know that I like this person, I would just be on their trail. I would maybe go to their social media, be their friend, things like that. Before you know it, you are building a connection. And when you drop a question, they now know your name and they're able to give you preference to answer your question. So you have to build relationship. That's how I see it. Thank you so much. Everybody has been saying beautiful things about this live session. Thank you so very much for coming, ma. Thank you so much. Rural
Welcome.
nursing is very rural. That's why when she said she worked in Nunavut, I was like, Nunavut. Even this slave lake, I'm almost dying, let alone going to work in
In
Nunavut.
Slave Lake. Oh, that's
Yes,
beautiful.
I'm in Slave Lake. I mean, I'm in rural nursing right now in Slave Lake. That's why we do everything here. We are the cook, we are the gateman, we are the
That's good. Good job. Well done.
Thank you, but I said I've connected to her on LinkedIn. Yes, she's. I'm going to connect with her when I finish the program as well. So it's amazing. We just need to. We need to. Do we have any further question? Let me see if I drop more consulting. Do you have any question? Let's go and establish our practice. So more consulting. Let's go and do midwifery practice. Anywhere there is money and flexibility, I want to be there because I'm a mom. Please. Then Ma, so your last words, are there words of encouragement that you want to pass out there to nurses, to midwives?
Yeah, I just want to say something. I'm guessing that the population I'm speaking to, I think we have more
Mhm.
colored individual in this conversation, maybe mostly people from Africa. And I just want to encourage you. It's challenging. I must have said it, and it's really challenging to come into midwifery uh, profession as a colored person or as an immigrant. Let me just be like as an immigrant generally. It's challenging, but it's doable. And I just want to encourage people to, all you need is to put in your best in it. Um, Having a baby is something that live with you for the rest of your life as a woman. And uh if I call you like in the next 50 years to tell me what happened when you were when you were pregnant and when you were having your baby, you'll be able to say it. A lot of women are living with the trauma from birth, from having a baby. Some of them have been traumatized and they've lived with that trauma, and that trauma has led into so many complications in their life, and that trauma has also labeled maybe the child that was born. And the reason why we I do this work is, uh, to do my best to offer a lasting experience, an experience that is rewarding, a rewarding experience for every mom. Every mom deserves a good midwife. They deserve the best pregnancy experience and birth, and more midwives will help. We in Canada, we are overworking ourselves. We're tired because at times you take in more clients that you shouldn't be taking because somebody is walking into your office and is crying and say, Joy, I need a midwife. I have nowhere to go. Please, can you take me? And you can't turn your back at them. You just have to take them. But when we have more midwives, then we have more midwives that can offer these services. There's a lot of burnout. People are burning out. Some midwives are just like, stop. This year, I can tell you some midwives that say, you know what, I'm not doing this work, I'm doing something else because they don't have that relief. So coming into midwifery, like I said, we need more midwives in the rural. I'll just use Alberta as an example. We need midwives that can go into the rural and provide this wonderful care and show love to these women, be part of their story, make their story a rewarding, something they can look up to, they can remember, and it will bring joy to them. That's all we offer, joy. That's all we offer for that experience. So I'm encouraging you. The getting into it may be hard, but don't be discouraged. You can go ahead. Even as a colored person, there's a lot of pushback, there's a lot of discrimination, but know what you have, that you can actually offer it. And midwifery is midwifery anywhere. Whether you are trained in Canada, you are trained in Africa, you're trained in the UK, wherever you are trained, is the same midwifery, is the same cervix, is the same uterus, is the same babies, and you can do it. That's what I'll say to you. Thank you.
Thank you so much, my everybody. I've been saying thank you in the comment section. This is by far one of my best YouTube live. Thank you. So it is rich with information. Every question I've asked Cash, everything was direct, straight to the point. You gave the information. So this thing is power. You just need to just catch a replay. If you know that, you've missed any part, I know that we cannot all join at the same time. That's fine. This will be on YouTube for life. So we hope that more midwives will see this, and we hope that sometimes again we'll call her to come and come to the channel and give us some more information as we would get. Thank you so much, everybody. Do we have any more questions? Maybe one or two last questions before you finally. Thank you so much, Mao. She spent 30 more minutes because we booked her for just 1 hour. Unpaid.
Thank you. You're lucky today. I'm free. Like no call. That's good.
I'm paid.
Thank you so much. Yeah, thank you for all you do for
thank you,
internationally educated nurses and midwives. I watch your program at times. We need more of you. Thank you so much for what you do.
Thank you,
yeah, all the support. Yeah.
Thank you. You're registered midwife currently in Saudi. We want more midwife in Canada. What are you doing in Saudi Arabia? Come to Canada.
Thank you, everyone. It's really nice time to talk about.
I asked earlier for our intention ICU. We are not talking about ICU today. Okay, I'll look for ICU nurse. I'll bring ICU nurse. But today, midwife. Midwife. Today is midwife, please. Not ICU. Thank you so much, everybody, for joining us. Catch a replay. Tell your family members to come and watch the replay of this program. It is so rich. So if I get an ICU nurse that is willing to come, we'll bring them so that they can tell us about ICU pathway. And then we know. Thank you so much, I really appreciate you coming. I'm so grateful. I'm so grateful you came because I know how much you will make in this 1 hour, 30 minutes, and you're giving us free. We are so yes, she has social media. I think she's on LinkedIn. I don't know if she has any other social media.
You can follow us on Chinook Midwives.
Yes, Chinook Midwives. Let me pin it.
Yeah, we're on Facebook. We're on
page.
We have our website.
Yes, I will post the website. I have it.
Yeah, we're on Instagram too. You can follow us and watch all our birth stories there.
So let me pin our website. This is our website,
www.chinookmidwives.com.
I'm just trying to pin it.
And we have other midwifery practices too. You can explore and see in different locations too.
So this is how you can check their website out. That's the website. And then, connect more with the website. And then, some of you that are close to where she said she's in Lethbridge. Because for me, I try to do my things in a way that I know. If I was in Lethbridge, all I would have done is to follow check out this thing, go to the hospital one day, maybe a practice, and just know, oh, good afternoon, ma, I came to see or something. If she's free, she will attend to you, but I'm not in Lethbridge. I cannot fly to Lethbridge right now. So that's the only thing. If I was in Lethbridge, Monday morning, she'll see me in a practice. I'll take picture with her and then post on my social media that I I, because midwifery, they are so rare in Canada. I don't think even here. When I got here, I called to say, "Do you have any midwife?" There was none. They told me that I have to go 2 hours or 3 hours away, and it wasn't because I needed. I just needed that. I was interested in midwifery when I came here, so I felt okay. Maybe I need someone. I need to watch somebody. There was nobody for me to watch in the whole of Slave Lake. We don't have midwifery.
Yeah, we need midwives in Slave Lake, you know. Yeah, it's one of the places. That's why I said if we have more midwives, then we can send people
Yeah.
to Slave Lake. Grand Prairie, we started that in 2019, 2018, 2019.
Mm.
And, you know, we have more places up north, you know, that we need more midwives. Yeah.
Yes, we actually do. We actually do need more midwives. We don't even at my place, we don't have the RNs taking deliveries are the ones that have NRP. Not like we have anybody that's a midwife. We don't have in the whole of my hospital, we don't
Yeah.
have any midwife. We have gynecologists, we have RNs that are, experienced, but not they're not midwives.
Yeah.
They're not. Thank you so much, everybody, for joining the live session today. You have been amazing. Thank you so much, ma. Thank you. I can't say thank you enough. Thank you so much, everybody. So I'll end the live stream now. If you want to catch a replay will be available immediately after this live. Thank you so much for joining us today. We'll be back with another live. Bye. Thank you, ma.
Bye.
Yes, ma. Oh,
Okay.
are you still talking, ma? Oh, I wanted to be sure you're not okay. For this one, if I get an ICU nurse, so what I do is that I have to, I have to scout for this. I have to look for people that are, and it's not just bringing anybody to the channel. I try to make sure that this person I'm bringing, I probably watch them close. I see what they do, things like that. That's when I bring people to the channel. So if I see an ICU nurse in my place, we don't have an ICU yet in my place. If not, I'll have invited one of the nurses, but we don't have. The nurses we have there are Image nurses. I'm thinking of inviting one of them, but they're Image, not ICU nurse. If I find one, I will surely bring the person. To begin the process, you have to watch a replay. So, do you have any nursing question? Maybe I can answer for like 10 minutes. Anybody with any general nursing question? I can answer for like 10 minutes before I log out. I need to log out, but I've not seen my children in over 1 hour. So, any nursing question? Somebody was asking a nursing question the other time. I can't remember. So if you have any nursing question, you can drop it, one or two. I can quickly take one or two general nursing question before we log out of here. And then watch out for more live show. I pray to God for strength, to give you strength to do YouTube. YouTube is a lot of work, but I pray but people need information, right? So we just have to keep doing what we gotta do. So I think there's no question. I'm going to log out. Yes, it's very doable. Thank you so much for joining today. Pass this replay. Please, before you log out, like this video. Please like this video before you log out. Like the video. Just like. That way YouTube will show it to more people. Please help the channel to grow. Like this video before you log out. Show it to your friends, your family members. Thank you so much. Bye. See you on another live session coming up shortly. Bye for now. Bye, everybody. Bye. Have a great weekend.